from the 1st of August to the 10th of August, we shall be having the 10 days of postpartum hemorrhage activism. Now, PPH is the first leading killer disease among women who are giving birth in Uganda. And of course, now the Ministry of Health will be celebrating the 10 days of activism, where we shall be shouting around postpartum hemorrhage that no mother should die after delivery due to excessive blood loss. And of course, this has got you covered for all those people planning to be pregnant, those who have given birth, and those who are preparing to get married should know about why maybe the postpartum hemorrhage occurs. Where does it occur from? And of course, at which stage does it occur before delivery? Does it occur? But of course, when you hear postpartum, partum means delivery, and post, you've already given birth. Just like that. Those are the health days that are coming on board that we ask you as our dear viewers. When you see the posters or the flyers at the Ministry of Health everywhere in your WhatsApp groups or the Twitter and others, embrace them and learn from them. As we also intend to bring you here the specialists and the consultants that will be demystifying more of the complexities that surround the health world, the health world, of course, around you. I was about to say the nutrition world, yes, because I have understood the language of food and diet. That's why my tongue quickly goes to nutrition. But of course, I also want to encourage you that our social media platforms are always open. Google Data Vision can be found on all social media platforms, on Facebook, Twitter, also known as X nowadays, can also be found on Facebook, and of course YouTube. When you go on, please put Google Data Vision, and of course you can watch us live. But most important is that you can go ahead and download the Google Data Vision app from the Play Store and have it in your phone, and always watch us wherever you are. Wherever you are traveling to, you are not limited to watch Google Data Vision. But also most fascinating is also that on your TV. Your TV, it's an online TV that you go ahead and download it, put it in your phone, and always watch Google Data Vision with all Christian television programs that may encourage you to get saved, that you come closer to God, and of course, He'll come closer to you, you know? And of course, we want also to always extend our love, our greetings to every person who has benefited. And of course, just like we often say, that if you are encouraged by this program, or if you watch and you feel that you have a testimony, maybe you listen to one of our health specialists, and maybe you went to do the medical checkup and you were helped by this program, just call those numbers displayed on your screen, and then we shall reach out to your family, to your home. We come there and we take that story. That will be important for us to air on the TV here and encourage other viewers that yes, it is possible, and yes, it can be done. And of course, I want to thank you and everyone who comes to watch this program, who puts on their TVs every Wednesday, 8 to 9 p.m. And of course, I am always Kamara Daniel. And of course, this program will always air all the time, every Wednesday, 8 to 9 p.m. And of course, to bring you the health specialists that are very important to demystify the health complexities around your health. And of course, now I am going to go for a short, quick break, but when I return, I shall come with the health specialist, Dr. Mirembe Joel, and of course, we shall be discussing about important topic, the health-seeking behavior in Uganda that is very low. According to statistics, 2 in 3 people do not seek or do not access the medical care services early enough. And of course, this poses us a big problem. Now, of course, 2 in 3, that means almost 95% of these people do not properly seek the medical care that is necessary. Now, I hope to see you shortly in a few minutes.
TV, lighting your soul. eri omuzadde nawe omwana asoma okubeera omusawo fuba nnyo wegatte ku ssomero Wakiso Comprehensive Institute of Health Sciences School of Nursing and Midwifery lisomesa certificate in nursing, certificate in midwifery, diploma in nursing ne diploma in midwifery extension. Eri abaana b'obuwala n'ab'obulenzi tulina ebikozesebwa mu kusomesa abasawo nga computer lab, skills lab n'abasomesa abakugu balina Human Center number wamu n'ebisulo saako ne school van ezikozesebwa mu by'entambula. Jangu wewandiise mu January ne July intake naddala gw'amaliriza senior eyokuna nga wayita amasomo ga science. Tusangibwa mu Wakiso district ku kkubo lyennyini erikirira ku kisaawe ekya Wakiso Resource Center. N'olwekyo yita mu bwangu ojja ofuna ekifo mu ssomero lino. Okumanya ebisingawo yita ku 077273255 oba 07047043255. Wakiso Comprehensive Institute of Health Sciences School of Nursing and Midwifery. Twegatteko.
Come and achieve your dreams with Makere Day and Evening Classes for Adults, a school that caters for those that never completed schooling at any level. We are located at Kakajo Zone, opposite Sir Apollo Kagwa Primary School. We offer both arts and sciences with language subjects according to individual choice. We also offer computer studies as well as counseling. We have got well-experienced teaching staff with the UNEB Center. We also offer accommodation. Our fees structure is very friendly and the school has helped many to achieve their dreams in life. Register with us today at Kakajo Zone, opposite Sir Apollo Kagwa Primary School, or call 0772-421-059 or 0772-635-754. At Maeka, we say education has no age limit.
God's Way High School Maganjo. With immense gratitude to God, we celebrate the outstanding achievements of our O and A-level students. At O level, we are blessed to have 2 students scoring straight 8s, 2 scoring 9 in 8 subjects, and that impressive 103 first grades. At A level, 3 students achieved an outstanding 20 points, 2 scored 19 points, and a remarkable 8 scored 18 points. We are incredibly proud that all 100 students met the university admission requirements. These results are a testament to the hard work of our students, teachers, and the unwavering grace of God. Here's to continued success.
Omusumba Favour Senfuma hakwaniriza mu kyatumye Sing Your Prayer Thanksgiving. Jangu weyunge ku Musumba Favour Senfuma gatwebaza Katonda olw'obugabirizi bwe akaseera konna. Sing Your Prayer Thanksgiving yakubeerayo ku Lwomukaaga ng'ennaku z'omwezi 10 omwezi ogw'omunaana omwaka guno okuva ssaawa 3 ez'okumakya okutuuka 11 n'ekitundu ez'akawungeezi ku United Christian Center e Makerere. Pastor Favour Senfuma era wakulonkinga ekitabo kye ekituumiddwa Beautiful Scars 14 years with the Levites. Abakulu okuyingira emitwalo 2 ate abato omutwalo 1 ne VIP emitwalo 5. Sente zonna ezinakuŋŋaanyizibwa za kugenderera abeetaaga obuyambi mu Apostle Stephen Senfuma Foundation ate nga kwoteeka okuyambako okuzimba chapel ku Steva Christian High School. Jangu wabeerewo mu Sing Your Prayer Thanksgiving. Pastor Favour Senfuma akulindiridde nga biwakiddwa United Christian Center Kasobe, Steva Christian High School, Sango Stationers, Proverbs 31 Women, Inaman Yogurt, Inaman FM, the Apostle Stephen Senfuma Foundation. Okumanya ebisingawo 07775
Pastor Favour Senfuma would like to invite you for Sing Your Prayer Thanksgiving. Come and join us to appreciate the Lord for His ever-present help in all seasons. On Saturday, 10th August 2024 from 9 a.m. to 5:30 p.m. on the Yacht United Christian Center Makerere, there will be a book launch entitled Beautiful Scars 14 Years with the Levite. Tickets for children are sold at 10,000 shillings, adults 20,000 shillings and 50,000 shillings. The funds collected will aid the needy in Apostle Stephen Senfuma Foundation and also help to build the Students' Chapel at Steva Christian High School. Therefore, come and be a part of Sing Your Prayer Thanksgiving. Sponsored by United Christian Center Kasubi, Steva Christian High School, Sango Stationers, Proverbs 31 Women, Inaman Yogurt, Inaman FM, and Apostle Stephen Senfuma Foundation. For details, contact 0776 507 780. Don't miss out.
Gugude TV, lighting your soul.
Friends, you are once again most welcome to Google Data Vision. This is Health and Beauty Program. Just like I said, I am Kamara Daniel. And of course, I brought you Dr. Mirembe Joel, the Secretary General for the Uganda Medical Association. And of course, we are tackling the health-seeking behavior in Uganda. Just like I earlier said that 2 in 3 people do not access the medical care services early enough. This predisposes people to die prematurely. Either they reach the health facilities with a lot of complications, or they succumb to death, and also they may get other complications that cannot be reversed by the medical personnel. So Dr. Jerry, you're most welcome to Google Data Vision.
Yeah, thank you very much, Mr. Dan Kamara, right? For inviting me to Google Data Vision. To the viewers, my name is Dr. Mirembe Joel Nsubuga. I am a practitioner of medicine, a teacher of medical students, and a leader in the healthcare sector, currently as the Secretary General of the Uganda Medical Association. I am passionate about mobile healthcare and community healthcare, so that I have given myself a responsibility to be a teacher of the community on practices that they must have to ensure that they keep safe. You know, since it's an introduction, there is a thinking and a myth that when people don't get sick, doctors will not get jobs. No. In fact, we are better off when you people don't get sick. Why? You will still come for health checkups. You will still need us to teach you to keep healthy. So for us, we are safe. Please don't get sick, because when you get sick, you are breaking down the economy, you're breaking down your families, you're breaking down your communities, you are breaking down the futures of very many people around you. Okay. I want to, since it is an introduction, greet the doctors in the country and thank them for serving Ugandans across. Of course, all other health workers, the allied, the nurses, you do an incredible job to relieve pain, to relieve suffering, and to save lives of people who need your help. Please continue to do it. But also let me give a message to the seekers of the health care. These doctors and health workers, as they do this work, they need to be remunerated. They need to live a good life, such that they come when they are in their normal health well-being. You know, it's not good a sick person to treat another sick person. You get it? So that is also important. Basawo need to be facilitated, need to be paid well. Please pay the consultation. And go to hospital when you're still not in a bad shape. Don't go when you're about to die. Otherwise, we may fail to save you.
They should come when they still have money. Not
Sometimes they spend the money in
you. Like about the health seeking behavior. We want first to define actually what is health care seeking behavior. And of course, from there we shall dive into the pillars that form up this thing, maybe the telemedicine, the what, and of course the barriers to the quality health seeking behavior. And of course, we dive into those challenges, then we derive the solutions to the public. And of course, then we shall also talk about the common diseases or conditions in the public that are not normally sought for healthcare services early enough. And of course, how this has affected. We do not want the statistics. And every time they say 5 in 10 people have this, 1 in a million has this, and that I don't want Ugandans to always count a big statistic on the healthcare reports that are always dispersed by international agencies. Yes.
Yeah, so it's very important. First of all, the viewers should thank Google TV for providing time for a healthy conversation. That means Google TV values its viewers, that it wants to keep them alive. You guys are not like these lice in Kukunyi and whatever. They feed on their host. When their host blood is done, they will also eventually die. So for you are keeping your viewers alive so that they can keep viewing you, keep bringing adverts and all other things.
Okay.
But now, what is the healthy seeking behavior? I will not use medical terms, but I want to say healthy seeking behavior. We are seeing that the practices, the attitudes, the inertia, ability for anyone, anywhere, irrespective of who he is, to initiate seeking health care attention in time. I'm defining it from the positive. Of course, there is what we call poor health seeking behaviors, where people don't go to seek or to get the attention of qualified, trained health workers. They can be doctors, they can be a midwife, it can be a paramedic, it can be a nutritionist, any kind of health worker, depending on what ailment, what disease, what concern this particular person has got. So health seeking behavior is a very important parameter of health care, of any family, of any individual, of any community. And when a community has poor, in fact, let me start from the positive. When a community has good health seeking behaviors, you realize there is growth economically, growth in civilization of that community. There is a growth in the individual people. Education is ongoing very well. You see everything. The people are sane. They are healthy because of good health seeking behaviors. Why? Why does this happen? If someone goes to hospital early, usually they cure early and go back home, or actually they're never admitted. 2, they spend less money than they would have spent when they are very sick.
Exactly.
Their chances of getting healed are faster and high. Why? When you seek health care early, you detect disease early. When you detect disease early, treatment modalities are still many. Treatment options are still many. The more advanced the disease is, the narrower the available treatment options, but also the lower the chances of recovery to full function, or actually never to recover. Let me illustrate this using cancer. Most of the cancers, when we are at stage 1, they are curable. Many of them. They are curable, I'm saying completely. But when you come stage 2, 3, 4, palliative care, hey, the cancer is here, we are going to give you some medicines, we are going to do radiotherapy, we are going to even do maybe some surgery. But it is not going to go away. We are simply trying to extend how much more you can live. But if it is detected early, my friend, you will be cured and you will go back to your normal function. So that's basically how I can illustrate the value, the importance of good health seeking behaviors. We shall talk about maybe the disadvantages, and they are numerous. And when you compare countries who have good health seeking behaviors and those which don't have, I can use communities instead of countries. And communities, for example, we can see the elites, abasoma mwe, bakamara mu abasoma. And my grandmother, somewhere in Bukunge village, Maokota, where I come from. You get it? You realize that the basoma will usually seek health care first. You know why? Baina mwaka senda akatinitini. Balina, they have access to information. They have the smartphones, like now I can even Google a few things here. Two, they are where they reside. They are the people who have the TV to watch Google the TV. So for them, they have understood the value. So they take up that good health seeking behaviors to exploit the value. Whereas my grandmother somewhere in Bukunge, Chituntu, Buama, can choose to not to go to hospital, not because they don't want. One, they don't have the money. Two, they don't have access to a good facility where they can go. When they got these facilities, the training of the people working there, some of them are not are run by people who pretend to be Basao when they are not Basao. Then the capabilities of these facilities are not also good. So you calculate transport from Mwakota to Mulago, to Nakasero, to Platinum Hospital, and the like. Itself already is high. It's enough to purchase over 4 or 5 tests. And the line is also long. And the hunger. And Goriwa nutrition. The hunger is very important. Hunger kills people in Karamoja, my friend. Even in Karamoja, even when the queue is very long and you wait to see that specialist, so, you feel tired and you hear. Yes, so that environment is, that's why for us, we are trying to build a model with other colleague doctors of taking this health care to the people. We are thinking on a model where doctors move from wherever they are to the community now, to teach. Now, Doctor, you're going to speak those in the forms of the healthcare delivery. Yes. Where you are trying to be innovative. You should be the Doctor of the Year 2020. Thank you for that compliment. Viewers, you are most welcome once again. For those who have just joined us, you are live on Google Data Vision, and we are talking about the health-seeking behavior in Uganda. And of course, now we want to dive into the modes of healthcare delivery into the communities, into wherever you are. If you're in Karamoja, if you're in Kanung district where I come from, if you're in Kisoro, if you are in Mawokota, if you're in wherever you are, and how can you access these healthcare services very fast? And of course, reaching out to a qualified medical personnel. That's very important to note. Not every person you meet on the street can be able to interpret your health condition and help you the way he or she is supposed to help you. Of course, I'm still joined by Dr. Mirembe Joel. He's the Secretary General for the Uganda Medical Association, but also a lecturer at the Ernest Cook University, just here at Mengo Hospital. Dr. Joel, I still have you, right? Yes. So you're going to tell us the modes of healthcare delivery that people in the communities can easily access, and how you are trying to reach out to the communities in that perspective. And who is going to remunerate you? And after you say that you want remuneration, I guess this is God-driven drive that is going to use you. So thank you very much. One, our people already know that hospitals exist, clinics exist, but they have not filled the gap enough. So even developed countries actually are embracing and advancing these models of taking healthcare to the community than the people coming to the community. Someone said, and research has shown, that sometimes for the general community, teach them a principle for them to grasp it. If you teach them for a year and they take up at least 16% of that message, you are a very good teacher. I'm talking about 16%.
16%.
Yes.
I'm a good runner.
So, so for the general population, you need to put systems in place and persevere, continuously teach them. So that's why for us, we think that health care should have telemedicine, a well-established telemedicine system, whereby people in the community, I am having a fever and a headache, I can call. And I'm picked up. If it is a government facility, ngasisasula. Nga insurance, government is asuli. If it is private facility like a medical services, it are doctors, you pay and then you are seen. Okay? And that system should be well developed to ensure that people's information is captured rightly, there is privacy, there is everything that we preserve in the standalone buildings. So, 2, medical camps and mass education. I've seen you yourself run and be part of medical camps in the community. Those ones are very important. Recently, we ran a medical camp last year in Maokota where we saw 800 people in one day.
It was one day.
Yes.
I've seen today's event, you see like 2,000.
Yes, 800 people. We had around 30 doctors.
That's a very big
and Uganda Medical Association Central Branch. So now, when you announce an event for just 2 days and 800 people turn up, that is not just about the turn up. People are there, they have the need. It is showing a needs. You are actually directly doing a needs assessment. People came. We reached the time people wanted scans, the abdomen. They had a lot of issues. And the power left as if you were there.
No, usually
at around 3, power 2. No alternative. We had not secured a generator because, of course, of the little funding that we had. So now women were crying, children were crying, they needed a service. Of course, we are doing all other services, lab, health education, then the real treatment of clerking patients and treating them. At some point, we wanted to put a model for surgery, mobile health care surgery. If we reach that level when we can have the resources.
You can buy a van.
You said we can buy. We're going to fundraise. We can join Google TV and we do that. And we shall be impacting community. But also, it's not good to develop a mentality that people should think health care is free.
True.
Free health care, usually there is less treatment. It's not effective. It's not sustainable. Can do philanthropy work.
It can be effective, but cannot be sustainable.
Yes, we can't sustain it. We can come and see you one day, but then what happens
Finish
tomorrow?
Another 1 year without coming.
Exactly.
Because it was a
So
big arrangement.
we must have sustainable models of community engagement. These medical camps should be routinely done by government facilities in the community. You know, when we are growing up, when there are white people, white Basao, used to come in the community and do immunization. You get it? Why is it that we no longer see them come to immunize children?
Yeah, last night I
in
was
the community?
passing around Nigeria, yes. And I heard the person, I knew immunization is for free until last night when I was passing in Nigeria, and I heard that is for 50,000. They were passing this and they're inviting people to go for immunization at 50,000. And I was like, what?
Immunization is supposed to be free in government facilities. Even in the private facilities which partner with the government, they charge a service fee, sometimes 5K, others 10, others even 20.
But not 50,000.
And above. But there are private vaccines which are privately procured of sometimes different quality than government vaccines.
What would be the difference?
There are several brands. For example, I'll give you there, you're a health worker, for example, there is several brands of ceftriaxone, where we have episavin of like 20, 25, 30, 45. Then we have a brand of which goes for 100,000. Just one what?
But
short. So that's what can explain that. But there are also dishonest people who exploit unsuspecting people.
Exactly.
Okay? So that cannot be also ruled out.
But in Uganda, where we are in now, where we are standing in now, it's very, very strange for you to tell me that you have a different brand from what the brand that's on the market. And you're trying to, we all know where we are in now, and every person should be cautious. Instead, you should not buy vaccines at the moment, unless it's a reputable hospital.
Yes, that is true. I have children at home. And one of them, we wanted the immunization of a particular, I will not mention the facility. And the quotation which was given to us was 200,000 for one shot.
And that shot is...
Of a measles vaccine.
And measles, the way it is widespread.
So, what I'm saying, I have evidence. My own children being immunized. So, but now, for me, I have a capacity to identify and differentiate because I'm trained in that. But now, common people don't have. So, vaccines from government facilities are safe. So, I advise people to go for them. So, now, medical camps are one of them. But how are we delivering these medical camps? We already know there are several clinics with the certificate nurses, maybe with some lab people, maybe with some clinical officers. When we take the medical camps, they should bring additional expertise beyond what is already existing. Then we should also teach the people to begin paying something. When you organize a medical camp, people should at least each should maybe pay 5K as a commitment. You get it? Such that this 5K can maybe feed the Basau.
Like,
can maybe pay fuel for this Basau. You get it? Because like I told you, I don't encourage. People are paying there are these people who lie about health care. People who just put up concoctions. People are paying for things which even destroy their kidneys and liver. How comes they cannot pay for health care services?
And they are very expensive. Just
from
like a bottle.
Trained people.
100.
You get it? They are paying expensively for quackery. So our people should also pay us, their children, because it is the communities I'm talking about that have educated us. They have groomed us, paid fees, painfully. You get for us. But then there are some people who demand money from us, but then they don't want to pay us to give them a service. Where shall we get the money? So I want to encourage everyone, wherever you are, please pay your doctor, pay your nurse, pay your lab guy, pay your nutritionist, and demand for quality health care. If they are not giving quality, move on and get another one.
Wow.
You get it?
Wow, that's very amazing. And of course, now we would want to do to run into the most common conditions that you would want to tell the public that are common when you go to the community on the ground level. What are some of those conditions that are not usually sought of medical care? So before we go there, I want also to talk about this. Please do. There is no way we are going to access health care without extremes of financial burden when we don't embrace insurance. I'm not even talking about these big insurance companies. Today we are talking about the community. We should form our own community initiatives when they are focusing on health care. The same way we have circles to borrow money and put in our midala, put in our shops, put in our gardens. We should have what we call community health insurance schemes. These ones, we solicit, we keep, we invest money when its sole purpose is to ensure that when any member of us is sick, we shall be able to support him or her children or her beloved ones, and they go through that process of sickness without them first selling their land, because anyway, many of them no longer have their land, without first selling all the cattle at home, because anyway, if you don't have land, will you even have cattle? That's just a question that the viewers can answer. So we need health insurance. And for the last 10 plus years, MPs, we as the Uganda Medical Association, have been pushing for the National Health Insurance Scheme. Our neighbors here in Kenya have it
Rwanda have got it, and so many other countries in East Africa. For us, there was a joke that the president made recently, that those who want insurance are just cowards. Why do you need insurance? But the president is insured. State House staffs are on insurance. So what I'm trying to say is, the president, that bill has been taken to parliament. That bill has been sent to cabinet. The president should sign this bill such that us, the common people, can access health care without excess financial burden. We are paying for services in Mulago, in Chiruda, and everywhere. You get it? That's the truth. You see, I am a health worker. I've worked in any of these hospitals, big hospitals, as a medical intern at least. And I can tell you, government paints a picture of services are free. But they're not really free, because when you want a CT scan, you will pay. When you want a scan, you will pay. When you want a main of the lab test, you will pay. And official payment. Then there is undercover payment, ongoing in government facilities. Money solicited by cleaners, solicited by some health workers who are not following the principles. Then that payment which is guaranteed. One, you are going for theater. There are no drugs. Your person is going to die. You have to get the money and give it in such that they can run. They are the ones who know where the drugs are.
I hope, Dr. Joe, we're not diving into the corruption scandal.
No. But it's more than actually, this is a health talk show, yes. But corruption affects the quality, the access, the affordability of healthcare services. But we're not going there. Don't be worried.
I'm not sure.
For us, we are sticking on healthcare, delivery, access, and healthcare politics. They are all very important. Because if the people want that, if the people don't understand this, how will they know that? Because government has been promising that it's going to prioritize healthcare. I saw from the documents of the budget, the healthcare sector was given around 3 trillion, and the total budget is around 72 trillion. And I was a good math student with A's, at least throughout. And you realized it's about 4.9, not even 5% of the national budget. So that means in East Africa, we are the ones who have given the least to healthcare. Yet, when people are not healthy, they don't work. When they don't work, they put a burden on government. And government will not get the taxes it wants to collect. Yet our government should be able to collect enough taxes to such that it doesn't overborrow. You get it? So I want to tell government that investing in healthcare is one of the ways to actually ensure that they will get more taxes. Because research has shown that when you invest 100 shilling in healthcare, you get 300 shilling at least, minimum. In fact, some studies show 10. I mean, you invest 1,000 and you get 10,000. Where do you get such investment? So that's very important. Healthcare financing is very important. Also, village level. Then we do the medical camps. Then we establish these other models that deliver healthcare. You see apps. I am arguing the ICT industry should build more healthcare apps that are focused to the common person that don't need data. You get? Where we don't need data to access those apps. You see, today I was presenting my research at Makerere University before professors, and she's talking about high blood pressure. But that stage before you develop high blood pressure and then kidney disease. So the same way we are researching, they should also research, should deliver to us. Because in the village, my friend, network is very bad.
That is also another budget.
You get?
To do that.
We are very intelligent. You see me, I'm in Uganda, and the Kabaka said this generation of his is for Abavubuka. So let the youth, let the young people, as we do everything else, you see, we are being wasted in the bars. We are being wasted in gambling, betting. We are being wasted in being on social media. Let us waste our time in thinking. Let us waste our time in innovation for health care. We need a lot of innovation. There are a lot of gaps in health care. And these gaps I'm talking about today are for one of you a health worker, you know, delays in healthcare and their problems. Mothers, there are those 3 delays. Delay to decide whether to go to hospital. Delay in transit. Then when you reach the hospital, delay to get
The healthcare.
the healthcare. So we need to look at how to shorten the delay to decide. This program is helping us to shorten the delay to decide to go to
The
hospital. Such that now we can focus, at least if that one is eliminated, then we can hire border, we can
Accessibility.
accessibility. You see, you don't want me to talk about corruption, but the government has 100 ambulances plus which are not working. You know why? They don't have fuel and drivers and nurses to sit in them. And the government had allocated the money to do that. The money was removed in the last hour when the budget was returned to Parliament. See, that is also important, so that the people know.
It is true.
Yes. So that is now about the common illnesses. Of course, there are very many. We can't finish all of them.
We shall
Some of them are among children. Then there are those for mothers who are pregnant. There are those for adults. There are those among the youth. We shall start from the youth. The youth are overusing drugs. Marijuana. Some of them are learning smoking, very dangerous habits. Some of them they have these poor healthy habits. They think eating chips is if you don't eat chips, you are broke. Toina chogamba gwanga. You get. Then we have, for the mothers, very many. Anemia. There are many that are related to hygiene. For example, in Uganda, they say research is showing that 73 to 78% of infectious diseases we get them because of poor hygiene. You get it? So, Chikomando, that Chikomando guy is a good guy because he gives you cheap food. But then, the Katawel. But then,
He looks.
the way he does his work is stationed on the road. Every car that passes pours dust.
Even his clothes.
His clothes. Then, when that dust pours in the chapati, that dust has some fecal matter. Then, you come and eat a chapati and get typhoid. You come and eat that and get so many fecal-related diseases. So, hygiene is very important. Washing your face, brushing your teeth. These are very important things. Having a tooth problem can actually kill you. You die. Then that's now general. Then stress is very important. Managing our stress is why people go for drugs. Some have committed suicide. Some cannot even concentrate to think because of stress. So people knowing that their mental health status matters at the community level is very important. Why are you picking quarrels with everyone? Why are you suspecting every neighbor to be having a bad attitude towards you? They are bewitching you. They want to kill you. I think they are plotting to take my land. All those things, they can stress you. Of course, the economy, children, school fees, me I pay school fees, I know how it feels. Very stressing. Onomana kuba, no na kuba. Before you know, the grandmother is also asking for something. Before you know, you get. So we should learn to cope. You get. People don't have good coping mechanisms, and that is really badly affecting their health. And people should know that when you're stressed, your immunity goes down, gives you chance to be exposed to all these other diseases. But of course, I've not mentioned HIV. We have seen HIV prevalence increasing in Mbarara, Fort Portal, and all other places. HIV is still there. It still kills. It's a dangerous disease that we should fight. I should be here on this TV and thank God. Kabaka. Era Sabasajja nange ngatako eddoboozi okukulisaayo mu lutabaalo nti wooli ofuga Obuganda kaakano tuli basanyufu nnyo. Niye weebale nnyo. Sabasajja, the reason why I'm making this, at least is a leader of an institution that prioritizes health care. At least his birthday is about making sure we fight HIV. That awareness itself, you remember teaching how people pick just about 16%. You get it? So he was fighting sickle cell, he's building hospitals across the counties of Uganda, then the HIV fight. Very important. HIV. You know HIV, when you get it, you're a candidate for almost all diseases in the world.
Now, and of course,
especially when you're not taking your what? Your medicines.
And of course, now we are nearing to close this program.
Oh,
yes.
Thought
So
we had just started.
We are going to have, you're going to give us your conclusive remarks about the health-seeking behavior in 1.5 minutes, and you summarize everything that we've talked about. And of course, we acknowledge every person who tries to foster healthcare delivery in Uganda. And of course, I love Burange Mengo. The last time we had a medical camp, I'd never seen a such medical camp in Uganda. The lines were there by 5 a.m. I was also shocked. I didn't have where to start and where to end from. And I also did what I could, and I left Burange. But it was an amazing experience. And seeking healthcare is one of the best things you can do to yourself. Back to you, Dr. Joel, in a summary format that we can leave.
Yeah, thank you very much. Actually, also at Ita Medical Service, we partner with the Kingdom. Usually we participate in those medical camps to give back to, as a way of giving back to the community. So, one, viewers of Google Day TV, it's very important to seek health care anytime, in the right place, right health care provider, trained. When you seek health care in time, you save money. You save yourself of the stress. You reduce your risk of complications from disease. The money you save, the time you save, you can use it to do other productive things. So whenever every family should have a family doctor, we have an advantage. The number of doctors in Uganda has increased. At least every year we are sure that we shall produce 500 doctors in the country. So please, let us develop good health-seeking behaviors. Let us plan at a family, at a community level of how to protect our health and ensure that health is not a by the way. It should be a priority of every family, every community, every government. I want to end by thanking Google TV for this program, and I will promise to continue to come to educate. Yes, and also greetings to my people of Maokota, Nikayawe, Buama, Chituntu, of course, Abana Wokale, Buganga, batumidde nnyo ku lwa Katonda n'ensi yange wangaala ayisa abasajja kabaka wa Buganda. Service with honor bwe tugamba nga badokita.
Wow, thank you so much, Dr. Joel, for coming to Google Day Television. And of course, just a reminder that this program will be repeated next week, Tuesday, from 3 p.m. to 4 p.m. Do not come and watch, do not miss come and watch again this program in case you've missed any part of it for those who joined late. But also important, you can also download the Google Day Television app from the Play Store and have it at your disposal, and also your TV, always you can watch our health program. I am Kamara Daniel. I guess I can see you next time. Bye-bye.